Today, we are here to talk about access to AEDs and training for life-saving skills like CPR. We're going to hear from people whose lives were saved as a result of equipment and training. We're going to hear from loved ones of those who wish that their loved one had access to such training and devices.
Our goal today is to make sure we are normalizing heart health and actually life-saving access to AEDs. This bipartisan legislation will establish a grant program for elementary schools and secondary schools can use to buy and maintain AEDs and develop a cardiac emergency response plan. By boosting access to these life-saving tools, along with implementing proactive procedures and training schools and students can better be equipped to respond to sudden cardiac arrest when it's least expected and when time is of the essence.
Only 1 in 10 people who suffer a cardiac arrest outside of the hospital will not survive. These victims will not even make it to the emergency room to have a fighting chance at life. This is wrong, this can be changed, and this legislation is an important step on the journey to make that a reality.
1 high school student dies every 3 days in the United States. Our son Matthew collapsed June 16th of 2020 from sudden cardiac arrest at soccer practice in northern Kentucky, just 6 miles from the stadium in Cincinnati where DeMar collapsed. There were 5 AEDs on campus, yet no one retrieved an AED to apply to Matthew due to a lack of proper training and because the coach was never given an emergency action plan.
For schools that have AEDs, the survival rate for the children from sudden cardiac arrest is 7 times higher. The Access to AEDs Act will help ensure that schools are just as prepared and trained to respond in a time of crisis as those on the sideline of an NFL game. Every kid should have the same access to a life-saving emergency response that I did, should they need it.
When the world saw DeMar's cardiac arrest on Monday Night Football, what they also saw were those very first links in the chain of survival working. Everything happened like it should in a cardiac emergency. Early recognition, calling 911, first responders administering high-quality CPR, access to and using a defibrillator. If everyone who suffered an out-of-hospital cardiac arrest like DeMar's had that same opportunity to have those links in the chain of survival administered, think of the difference that would make in this world. And that is what this legislation will help us do.
I've learned I'm still here because there is an AED 10 feet from that tennis court I was playing on. I'm still here because people in attendance knew how to use an AED and they knew they could use it.
The care that you had, we're hoping we can get throughout the entire community of youth sports at some point in the future.
And that's why it's so important in this bill. We not only provide the equipment, but also the training so people know how to use the equipment and it doesn't lie fallow sitting there.
Let these moments not be in vain, but let their legacy live on by all the kids we saved. And so if next year there's 1 kid who's saved, once we pass this legislation, we did our due diligence and we lived up to this moment. I want to thank Nancy Brown and the American Heart Association for helping organize this event and their efforts to protect our children from sudden cardiac arrest.
We are so honored to be here today and to put everything we have behind this legislation to make it the law of the land. You can text AED to 46839 to urge your lawmakers to join us in supporting this important bill.